Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now, here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 333 of the Ask Dr. Angela podcast. It has been a minute and then some since I released the podcast. Things have just been incredibly busy. I don't know about you, but I have been busier than I have ever been between delivering a ton of babies, operating so much in the OR, momming, and just, the everyday hustle and bustle of life. It's been a lot. In more exciting news, I have been really busy doing a lot of cool collaborations and partnerships with various organizations. I just finished doing something with the PreventCancer.org organization, and that was really cool, which leads me to today's podcast topic on ovarian cancer. Last month, i.e. September, was actually Gynecological Cancer Awareness Month, and so even though it is now October, GYN cancer is diagnosed every month. So I still thought it fitting to talk about today's topic, which is ovarian cancer. And, ovarian cancer, it's one of those topics that inevitably comes up a couple times a week, whether it be during a routine exam, an annual exam. Sometimes women have family histories or, they might be experiencing some vague symptoms, like feeling full all the time, bloating, maybe they have a history of ovarian cyst, or, maybe they just want to make sure that everything is okay down there. Ovarian cancer is something that women worry about, and with good reason. I mean, let's just face it. The fifth cause of cancer-related deaths in women is ovarian cancer. And y'all know, what the ovaries are. The ovaries are ovara, and this is a bad joke, get it, ovara. The ovaries are overachievers. They are responsible for producing eggs or ova and, the female hormones like estrogen and progesterone. In the female reproductive system, the ovaries are found on either side of the uterus, i.e. they are bilateral. They're found on both sides of the uterus. And while most textbooks say that they're about the size of an almond, I'm going to tell you I think they're probably more in line with the size of a walnut. Ovarian cancer can spread outside of the pelvis to other parts of the body. A really interesting stat from the American Cancer Society is that they estimate that in 2021, 21,410 people will receive a diagnosis of ovarian cancer, and 13,770 will die from ovarian cancer. I think that's pretty staggering. So certainly, early detection of ovarian cancer is key to successful treatment and outcomes. And while there is no screening test for ovarian cancer, I'm going to say that again. While there is no screening test for ovarian cancer, what I really hope to be able to go over with you today are just some of the symptoms, causes and risk factors, types, stages, detection, treatment, and certainly prevention. Because remember, one of my favorite lines from G.I. Joe is knowing is half the battle. So let's talk about some of the symptoms of ovarian cancer. Ovarian cancer is sort of like pancreatic cancer in that it's oftentimes known or referred to as the silent killer. And what I mean by that is oftentimes by the time ovarian cancer is diagnosed, it's usually in an advanced stage. The symptoms of ovarian cancer, when they do present, they're often, very vague. They might mimic other conditions like premenstrual syndrome, intermittent bladder problems, irritable bowel syndrome type problems. Initially, symptoms of ovarian cancer can even be transient, meaning that, they come and go. However, as time passes on, these symptoms might, persist or become worse. Some of these symptoms include things like pressure or pain in the pelvic area, back or abdominal pain, abnormal vaginal bleeding, especially if you're past menopause. You might feel like you're getting full quickly when you eat. We call that early satiety. You might experience bloating, or you might even notice frequent urination or feeling like you always want to go to the bathroom. If you are experiencing any of these symptoms and, your usual maneuvers of like exercise, making adjustments to your diet, stool softeners, etc., don't resolve them, it's really, really, really important that you see your friendly OBGYN. Because these symptoms are often what we call vague or silent, most women are going to simply ignore them and think, oh, it's nothing, it'll pass, or, this is just part of what being a woman is. And it's this thinking that results in only 15% of ovarian cancer being diagnosed in an early stage. So remember, early diagnosis is key in successfully treating this disease. So when you start getting these symptoms that you think are no big deal or transient or going to just go away on their own, please don't ignore them. Please don't minimize them. Please listen to your body. So let's talk about, causes of ovarian cancer. And, while no one really exactly knows what causes ovarian cancer, the most recent finding does suggest that ovarian cancer doesn't necessarily start in the ovary itself. This is a huge finding. And actually, this finding has certainly affected gynecological practice in that, since we do now believe that ovarian cancer starts in the tail ends of the fallopian tubes, there's been a recent move towards performing what we call bilateral salpingectomies, or removal of the fallopian tubes, instead of doing the more traditional tubal ligation in women that are, wanting permanent sterilization. Other causes of ovarian cancer, it could be due to gene changes. The common genetic mutations that you've probably heard of are the BRCA1 and 2. These gene mutations are linked to ovarian cancer. And while there is no surefire way to determine who will and won't get ovarian cancer, there are some risk factors that might increase your likelihood of getting it. And so let's talk about those. Age. Age is an independent risk factor for ovarian cancer. Simply put, the older you are, the greater your chances of getting it. Half the cases of ovarian cancer are seen in women 63 and older. Ovarian cancer is rare in women that are under 40. Family history of ovarian and breast cancer. Ovarian cancer can run in families. If you have relatives who have or have had ovarian cancer, your risk of developing it increases. If you have a family history of other types of cancer, like breast or colorectal cancer, this also increases your risk of ovarian cancer. This is because certain cancers are caused by gene mutations, and they can cause family cancer syndromes, i.e. BRCA1 and BRCA2 mutations. If you have a family history of, ovarian, breast, colorectal cancer, there is genetic screening tests available to help screen for this. In women with strong family histories, genetic testing is advised because up to 25% of ovarian cancer is part of a family cancer syndrome. All right, another risk factor, obesity or being overweight. And you all know obesity has been linked to many types of cancers and medical comorbidities. So always being mindful of your weight is advisable. No history of pregnancy or having children late. Older women with no history of pregnancy or women who gave birth at age 35 or older are at risk of developing ovarian cancer. Women undergoing hormone replacement therapy. Women who undergo hormone replacement therapy after menopause are at an increased risk of developing ovarian cancer. Endometriosis. Endometriosis is a condition where the uterine lining, which is normally shed as your period or menstrual cycle, gets shot out through the fallopian tubes and implants on various aspects of your abdomen and or pelvis. So let's talk about the types of ovarian cancer. The type of ovarian cancer depends on the type of cell that the cancer starts in. There are 3 types of cells in the ovary: epithelial cells, germ cells, and stromal cells. Epithelial ovarian cancer, this type accounts for 90% of ovarian cancer. Germ cell ovarian cancers are very rare, How do we detect ovarian cancer? While there are, again, no screening tests for ovarian cancer, part of the workup is going to include a very thorough history as well as an exam. History is a really important piece of an ovarian cancer workup so that, the physician can identify any risk factors that might put you at an increased risk of the diagnosis. Risk factors can be broken down into two major categories: menstrual cycles, ovulation, and family history. The age of menarche, which is when a woman starts her period, and the age of menopause, when a woman stops having periods, are significant because the more a woman ovulates, i.e. the more menstrual cycles she has over her lifetime, the higher her risk of having ovarian cancer. Thus, starting your period at a younger age and ending your periods at a later age, or never getting pregnant, these are all important historical markers that put you at an increased risk of ovarian cancer. Family history inquiries are needed to determine if you have sisters, mothers, or other relatives that have had or that currently have ovarian cancer. Remember, up to 25% of ovarian cancers are related to family cancer syndromes. Because of this, all women with ovarian cancer should undergo testing for BRCA1 and 2. If positive, then family members of both sexes, i.e. male and female, should be tested. That should include siblings, children, etc. Part of the ovarian cancer workup is also going to include a pelvic exam. And while I do recognize that this is no one's favorite exam, it is a part of the workup. A pelvic exam is done to check for any irregularities, such as masses. Other tests that can be carried out include blood tests. So there are several blood tests that can be used to determine the likelihood of a woman having ovarian cancer. We're going to start with the ever popular CA-125. So I'm going to say this a couple of times. The CA-125 is not a screening test for ovarian cancer. I'm going to say it again. The CA-125 is not a screening test. This test should not be drawn unless a mass is present. In a postmenopausal woman, the presence of a pelvic mass and an elevated CA-125 is highly suggestive of cancer. A CA-125 is less accurate in younger women, as there are numerous disease processes, including but not limited to things like diverticulitis, irritable bowel syndrome, appendicitis, liver disease, stomach disease, etc., that can cause it to be falsely elevated. Other blood tests, such as like an OVA1 or the ROMA, are tests that can be used to determine whether a pelvic mass will be cancerous. I use the OVA1 and the ROMA in my practice pretty regularly when I have concern that a mass in the pelvis may be a malignancy. Transvaginal ultrasound. This is the gold standard of imaging anything in the pelvis. If there is a mass on the ovary, it will have characteristic findings that can be suggestive of cancer, including things like increased size, solid components, thickened walls, the presence of septations, the presence of external excrescences, etc. A CT scan or an MRI or other imaging modalities that can often be used. And then certainly nothing beats a biopsy, which is removing a small tissue sample and having it sent to pathology for a final diagnosis. Ovarian cancer is a surgically staged cancer, and certainly staging determines treatment. There are 4 stages to ovarian cancer. Stage 1 means that the cancer is confined to one or both ovaries. It has not spread anywhere outside of the pelvis. Stage 2 means that the cancer has spread to the uterus and other pelvic regions like the fallopian tubes or bladder. Stage 3, the cancer has spread beyond the pelvis to the lymph nodes and abdominal lining. And stage 4, this is the most critical stage of ovarian cancer, means that there has been distant metastasis, meaning that it has spread to distant areas of the body, like the lung or the liver. Treating ovarian cancer can involve several modalities. Certainly, again, staging is what determines what the treatment is going to be. Certainly, your general health is also going to play a role in determining what the best treatment option is going to be for you. So surgery. Surgery is the main treatment for ovarian cancer, and it's done to remove the tumor. It might involve a hysterectomy. It might involve removing one or both ovaries, fallopian tubes, nearby lymph nodes, and other pelvic tissue. Chemotherapy. Chemotherapy is used to kill cancerous cells. Certainly, chemotherapy can be given orally, by injection, IV infusion, or it can be given directly to the affected site. Certainly, the mode of administration is going to determine the extent of its effects on your body. There are also other targeted therapies. These therapies target those specific cells that promote cancerous growth. Targeted therapies lessen adverse effects, and it targets a specific part of the body. Examples include angiogenesis inhibitors, monoclonal antibody therapy, and other forms of treatment would include things like radiation therapy and immunotherapy. Treatments like chemo, radiation, surgery can impact future fertility. So in individuals where future fertility is important or something that you're going to consider further down the line, some things to think about might include oocyte freezing, which is where you freeze unfertilized eggs, embryo freezing, which is when you freeze a fertilized egg, freezing and preserving ovarian tissue, or ovarian suppression, which is when you take hormones to temporarily suppress ovarian function. Ovarian cancer survival rates. For ovarian cancers that have not spread outside the ovaries, the survival rate is 93 to 98%. For ovarian cancers that have spread outside the ovary to surrounding areas and lymph nodes, the survival rate is anywhere between 71 and 94%. And for cancers that have spread to the lungs and liver, i.e. like stage 4, the survival rate is 31 to 73%. So let's talk about how to prevent ovarian cancer. While there is no surefire way to prevent ovarian cancer, there are ways to reduce your risk. And certainly, factors that have been seen to reduce the risk of ovarian cancer include things like pregnancy and breastfeeding, or anything that decreases the amount of ovulating or menstrual cycles that you are having. We kind of mentioned that earlier. So if you have carried a full-term pregnancy before 26 years of age and breastfed your baby, this reduces the risk. The risk goes down further with each full-term pregnancy. Birth control pills. This, in my opinion, is probably one of the least mentioned benefits of birth control pills. Birth control pills do reduce your risk of developing ovarian cancer. I'm going to say that again. Birth control pills reduce your risk of developing ovarian cancer. Bilateral salpingectomy. I mentioned this earlier. Because we now know that the precursors of ovarian cancer begin in the fallopian tubes, removing the fallopian tubes, instead of doing things like the traditional tubal ligation, is much more commonplace. That certainly does reduce the risk of developing a future ovarian cancer. And at the time of hysterectomies for me, I'm performing bilateral salpingectomies instead of leaving the tubes with the ovaries. So again, plug for bilateral salpingectomy. Another way to reduce your risk of ovarian cancer, a diet high in vegetables and low in fat. And certainly, while not all studies agree that this type of diet will reduce the risk, I am going to tell you that lifestyle, which for me involves healthy eating and exercise, does pay dividends across the board. I mean, when you take care of your body, you reduce the risk of other medical conditions like obesity, diabetes, high blood pressure. And these things ultimately can increase your risk of cancer. See your doctor. One of the things with this pandemic is a lot of folks skipped out on their routine screenings and exams and haven't been to the doctor. Please make sure that you see your doctor. If you are experiencing symptoms that you're not quite sure about, if you have a family history, it's really important for you to touch base with your physician. So in conclusion, I just want to leave you with this. Women, please know your bodies. Listen to your bodies. If you're experiencing symptoms that are out of the ordinary or that have been persisting for a little longer than you think they should, please see your doctor. And if you have a doctor that isn't taking you seriously, see someone else. You do not have to wait this out on your own. Women, we are our sisters' keepers. The good news is women are defeating ovarian cancer every day. Early diagnosis and immediate treatment is the key. So I've said kind of a lot, and this is a lot longer than my normal podcasts are, but I really hope that you've gotten something out of it. For those that like to read, this blog post on ovarian cancer actually goes into much more detail, and you can find that on my website, www.askdrangela.com. That's AskDrangela.com. You can read the blog post there. I would love to hear back from you, whether or not you're an ovarian cancer survivor, if you know someone that has ovarian cancer, or if you just generally have any thoughts or feedback. I would love to hear from you. So having said that, I'm going to leave you, as per usual, with a quote from one of my favorite books. It's by Sandy Ingris. She Went Out on a Limb. It's a book of inspiration for women. And today's thought is, remember that pitfalls in your path are places to plant seeds. I'm going to say that again. Remember that pitfalls in your path are places to plant seeds. Thank you so much for tuning into this episode of the Ask Dr. Angela podcast. Please check me out on Instagram, Facebook, Twitter. Visit my YouTube channel. There's a lot more to come. See you soon for episode 334 of the Ask Dr. Angela podcast. Until then.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at askdrangela.com/terms.